dermatomyositis?
Well, dermatomyositis is most easily recognized of the inflammatory muscle diseases because of its characteristic rash. Occasionally, a rash alone may prompt a diagnosis of dermatomyositis called amyopathic dermatomyositis. If you don't have any muscle weakness, how are you supposed to treat that?
Dermatomyositis.
There is really no cure for dermatomyositis, but treatment can improve skin and muscle strength and function. The earlier treatment is started in the course of dermatomyositis, the more effective it is, leading to fewer complications.
What's the next pathology?
Next, we move on to the disease rhabdomyolysis.
Rhabdomyolysis?
Rhabdomyolysis. The Greek term rhabidos, meaning rod, twig, or stick. The Greek term myo, meaning muscle. And the Greek term lysis, a loosening, setting free, or releasing. So what is it?
Rhabdomyolysis?
Well, it is the breakdown of muscle fibers resulting in the release of muscle fiber contents into the circulation. Some of these are toxic to the kidney and frequently result in damage. The injury can be from physical damage to the muscle, but significant cases of rhabdomyolysis are more commonly due to high fever or hyperthermia, metabolic disorders, excessive exertion, convulsions, muscle trauma, flow of electric current through the body, or anorexia of the muscle. Rhabdomyolysis is a potentially life-threatening syndrome resulting from the breakdown of skeletal muscle fibers with leakage of muscle contents into the circulation. The most common causes are crush injury, overexertion, alcohol abuse, and certain medicines and toxic substances. So how do I get it?
Rhabdomyolysis?
A large number of drugs may cause rhabdomyolysis through several mechanisms, such as myotoxicity, circulatory eczema, hyperplexia, long-duration muscle rigidity. Drug-induced rhabdomyolysis is more common nowadays than in the past, due to the introduction of increasingly more potent drugs in the clinical practice. Any drug which directly or indirectly impairs the production or use of adenosine triphosphate, ATP, by skeletal muscle, or increases energy requirements so as to exceed ATP production can cause rhabdomyolysis. So how do I know?
Rhabdomyolysis.
Many clinical features of rhabdomyolysis are nonspecific, and the course of the syndrome varies depending on the underlying condition. The syndrome has local and systemic features, and early or late complications may occur. Prompt recognition of rhabdomyolysis is critical to preventing late complications. The signs and symptoms of rhabdomyolysis include dark, red, cola-colored urine and muscle tenderness, stiffness, aching, myalgia, or weakness. Laboratory confirmation can come from the demonstration of myoglobin in the blood or urine. What treatments are there?
Back it up!
Well, the treatment of rhabdomyolysis is primarily directed at preserving retinal function. Ideal treatment involves early and aggressive hydration with very large amounts of IV fluids to flush the myoglobin out of the kidneys. Bicarbonate may also help by making urine alkaline to prevent the breakdown of myoglobin into more toxic compounds. Early and aggressive hydration may prevent complications by rapidly eliminating the myoglobin out of the kidneys. The hydration need with muscle necrosis may approximate the massive fluid volume needs of a severely burned patient. This may involve intravenous administration of several liters of fluid until the condition stabilizes. If the urine output is sufficient, bicarbonate may be given to maintain an alkaline urine state.
I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it, move it. all over the world. Original King Julian on the case, man. I love how all the girls move their body. And when you move your body, you don't move it nice and sweet and sassy, alright? Woman, you're cute, and you don't need no makeup. Original cute body makeup on model. Woman, you're cute, and you don't need no makeup. Original cute body makeup on model. Woman, physically fit, physically fit, physically fit. Woman, physically fit, physically fit, physically fit. Woman, nice, sweet, fantastic. Brings your body out to the big Titanic. Woman, nice, sweet, energetic. Brings your body out to the big Titanic. Woman, nice, sweet, fantastic.
Let's start naming some bones. We got 206 of them. All right, cranium, mandible, scapula, clavicle, lumbar vertebrae, pelvis, ilium, humerus, phalanges, carpals, metacarpals, ribs, sacrum, patella, radius, tibia, fibula.
No, that's not fair.
What's another word for skull?
Cranium.
Very good.
Are you joking?
No homo.
Hey, I'm the role model for my class there. You did 6 o'clock.
Oh my God. No homos.
Why are you still watching? Presentation's over.
Move it, I like to move it, yeah, I like to move it, Woman, you cute, and you don't need no makeup. Original cute body makeup on model. Woman, you cute, and you don't need no makeup. Original cute body makeup on model. Eyeliner, on your face and make one mud up. Nose powder, on your face and make one mud up. Like your eyebrow, on your face and make one mud up. Girl, your lipstick, on your face and make one mud up. Woman, your nice broad face and your nice hip. Make man flip and bust them lip. Woman, you're nice and you don't get thick. Picture about the ocean at the big Titanic. Woman, a nice broad face and a nice hip. Make man flip and bust them lip. Woman, you're nice and you don't get thick. Picture about the ocean at the big Titanic. Whoa, 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 whoa. I like to move it, he like to move it, she like to move it, you like to move it, they like to move it, you like to move it, I like, oh, did I? Have I done I? Did I do I like to? I think I did, I like, we? What about we? They did they as well, okay. Oh, I got it, I got the new one. Them? No, is that, can I say them or not? Them like to move it. I'm gonna say them. Them like to move it. We like to move it. Wait, there's gotta be another one. We, us. Oh, us? Can you do us like to? Us like to move it. That's the one. Like to move it. Us like to move it. Us like to move it. Okay then, while you're here, I just want to tell you a little story. It's an old story that my daddy used to tell me. He was a king as well. I was born probably about 68 years ago, over by that tree over there, yeah. And I remember things changed a lot. In those days in Madagascar, it wasn't so commercial, you know? It wasn't all about money and who's got the latest tree and what leaves are you wearing and who's got the latest fur on their back, you know? Those days it was just me and a couple of the others, you know, doing the jungle boogie, you know. Jungle boogie. Ho, 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 ho. Move it. Do you really think this is never gonna end? Because it is. 3, 2, 1. Not bad, eh? I like it.